Hello, I'm Betty Casey, editor of Tulsa Kids Magazine. We partnered with St. Francis Children's Hospital to bring you important health information for your family. You can find all of our interviews on the website at Tulsa Kids and in the Tulsa Kids Magazine, and all you need to do is look for PJ's Corner. Today, we're going to talk about when and where to visit the doctor. With all the new technology and a variety of in-person options, seeing a doctor can sometimes mean a virtual visit. It can mean a stop at urgent care, or even the emergency room. But how do you know what's the best option for your child? So today we're talking with Dr. Jeffrey Rice of St. Francis Children's Physician's Pediatrician, who will help us figure out where to take our kids when they have that inevitable illness or accident. So welcome, Dr. Rice. I almost called you Dr. Jeffries. Welcome, Dr. Rice.
That is okay. I'll answer to anything.
Okay. By the way, I really like your shirt.
Oh, thank you. I have to have my kid-friendly outfit.
Okay. Okay, I know Warren Clinic and St. Francis patients have many options, and we know what a regular visit to a pediatrician's office is like, but there are also virtual pediatric visits. So when would you suggest that?
Absolutely. The biggest thing is it really depends on the severity of the child. If it's something simple, like most things in pediatrics, we still want to see in person because kids are fickle at best. They'll give you symptoms, and sometimes you can tease those things out of them. It really depends on the age of the child. Older children, virtual visit may be perfectly acceptable. Something like a rash that we can see a picture of, something what we'd call an e-visit. Where we at least can see it, and then if we need to ask questions or bring you in, we can. A virtual visit might do really well for something like a sinus infection where there's minimal symptoms. It also may do well for something that's going to be more like, hey, there's been a cough for a week or so, but no real fever or no other things, where you can look at somebody and say, okay, well, that kid's well, over the camera where there's no obvious issues. Those would be great times to do a virtual visit. I think we kind of lag behind a little bit in pediatrics because we still, as I said, kids are fickle at best. And so we still like to see them. Yeah. But I think we're becoming more open to that idea of those virtual visits as the technology increases. The hardest thing would be something like an ear infection, a pneumonia, any kind of concern for like a appendicitis or a stomach pain where you can't push on the belly. Those would all be things that definitely would not go virtual for me.
Okay. So you mentioned an e-visit. How is that different from a virtual visit?
So an e-visit is a lot more of a quick conversation, more messaging, and you can attach up to 2 pictures. It's something offered through MyChart, and it works great in the short term. And so, it's something like I don't necessarily want to say a diaper rash, but sometimes the diaper rash is what the people send us. Give us fair warning, please. But, small rashes, bug bites, you're like, okay, is this infected? Is it not? And as long as you can get a really good picture, it works well. The nice thing is we can kind of triage and say, okay, based on that picture, I need to see you in person. Okay. Especially if we're worried about something. So it gives us a good triage starting point. Okay. Yeah, that's an option for us.
Okay, so a virtual visit would be like what we're doing now, like where we talk or you're on a phone or something. But an e-visit, you might snap a picture of a bug bite or something and send it in. And okay, that makes sense.
Exactly. Yes, ma'am.
Got it. Okay. What about urgent care? When would you suggest that a child go to urgent care in person?
Absolutely. So urgent care, I always recommend calling your pediatrician first.
Okay.
If it's during the business day, most of us have spots where you can get in and get seen that day. However, if you have an immediate injury, so something like a potential for a broken bone that needs setting, something that might need imaging quickly, um, acute things like you know, um, like a sore throat, but you can't get into your pediatrician's office today, that would be appropriate for an urgent care. Um, the biggest thing that I would tell people is make sure that if you're going to urgent care, the the accidents. So usually what I would say is, sorry, let me just rephrase that. If you're going to urgent care, the things that I would usually go there for is going to be some kind of injury that's not life threatening, where there's no like decompensation, something that might need small stitches, and something that needs immediate, like, hey, we need to deal with this now, not in 2 hours.
Mhm.
Um, Something that is, a concerning illness where I'm concerned for dehydration, like vomiting, but I can't get them in into the pediatrician until, 2 days from now, and we're having trouble keeping down water or Pedialyte, something of that nature. So acute things that are going to be, worsening if you don't deal with them now. Does that make
Okay.
sense?
Yes. No, that makes total sense.
And
So
if I say anything that doesn't make sense, let me know.
no, you are. I cut my thumb one time and I had to go to urgent care, and I'm not gonna tell you how I did that, but
I have
it
had
was
plenty of urgent
it
visits.
needed immediate attention and it needed stitches. So I get it.
Absolutely.
What is virtual urgent care? I had not heard of this.
Yes, so virtual urgent care, it's a new program that they're doing. And a lot of this came about with COVID, where people didn't want to be seen in person or they were afraid of catching something. So that really progressed the technology. And so we do have some urgent care visits that can be done virtually, much like me and you are talking right now. You would just see an urgent care provider versus your normal everyday provider. They also have some options like the other one, like we were talking about, like the e-visit, where they will ask you a bunch of questions. Hey, I have this symptom. It started this day, and kind of go through the whole history with you, and then they can determine whether you need an antibiotic or something simple just during the little questionnaire. And so sometimes you don't even have to see a provider.
Hmm. So if I felt like maybe my child had uh, COVID, I don't know. I mean, going in for those tests or strep or something like that, would
Absolutely.
they tell you to come in for a test at that
They
point, or?
would. They would just take you to go to the lab. So essentially, whereas if you were coming in and let's say, hey, you come into my office, I thought you had strep pharyngitis, I would, do the exam, look, I would determine whether you needed the test or not. And then we would do the test and I would call you with the results and send an antibiotic if you needed it.
Okay.
Urgent care, they're going to do the same thing, or like with a virtual urgent care, they're going to do the same thing. The difference is going to be you don't have that initial in person evaluation. And so they're going to go based off the symptoms. They're going to go based off of um, essentially like, what you're telling them on that questionnaire. And then they'll say, okay, I think, yeah, you do need a strep test. And then you'll have to go to the location to do that. We haven't developed enough in-home strep tests to do that in
Right.
your home yet. So
Right.
you would have to go to a lab, but that would literally be it. You would just go in, get the test, and then you'd get a call with the results a little while later.
And then with urgent care or virtual urgent care, those options might probably be good, I would assume, on weekends or off hours, those kinds of times.
Absolutely. And a lot of these depend on your insurance as well. Some of
Okay.
them will be covered by their insurances, some of them will not be. So it depends on what your benefits are um, as to whether the visits will be covered or not. But absolutely, over the evening and over the weekends, these are all great options. If I'm not mistaken, uh, and I could be lying on this, but I think the urgent care, like the virtual urgent care e-visit kind of thing, I believe you have a 24/7 option on that, and I could be wrong on that specific part.
Okay. What about, let's talk about the worst case scenario, an emergency room visit. When should you take your
Absolutely.
child to the emergency room?
So absolutely. So any obviously near fatal accident. Let's just go ahead and start that out. And I hate to mention it, but it's summertime. Drowning.
Mhm.
Absolutely, you're headed to the ER. Any kind of respiratory distress where they are breathing faster, they're retracting, they are having trouble completing a sentence. Absolutely, ER visit. Any color change, color change to a body part, color change to a specific, you're around your mouth or they're turning blue, anything like that. Those are all immediate go to the ER situations. If you are vomiting to the point where you truly cannot keep down water, you cannot keep down, literally anything, and you're progressing, and baby's having less than or a child or baby is having less than around 3 wet diapers in a 24-hour period, that would be a time to get seen, especially if there's acute decompensation. Basically, like I said, the kids will do well, do well, do well, and then you see an acute change. That's something that needs to be seen then, not wait for the pediatrician tomorrow.
Mhm. Okay. So, are there more, you mentioned drowning potential. Are there more emergency room visits or quick visits like this during the summer months? Is there a seasonal aspect to any of this?
Well, yeah, I mean, it's going to be more season based with the drowning obviously being more in the summertime, usually more like ATV accidents, more heavy machinery accidents. Not that kids are driving heavy machinery, but ATVs, the outside UTVs, things of that nature. I would say probably happens more in the summertime. Snake bites, also, that's another one that I would go ER for,
Yeah.
which happens more summertime. Wintertime, you're looking more respiratory distress typically. More like, hey, 5 days of illness and then decompensates respiratorily or decompensates in a respiratory manner. That would be more like a wintertime thing. Broken bones happen in both. That would be potentially an ER visit, especially if it's open, where they could potentially need to do fracture. And by open, I mean exposing bone, muscle, things that you shouldn't be able to see on a normal day. Um, that would all be things that would need to be seen in the ER.
Okay. This is really helpful. So, and as you were talking, I thought about vacations, or maybe you're at the
Yeah.
lake or a cabin or camping. Maybe
Mm-hmm.
the virtual visits might be a really great idea initially.
Absolutely.
Yeah.
Those would be great, especially if you are somewhere where, again, you know how your child feels and looks. I mean, if it's something simple like, hey, I need to check out, this, he's vomited twice.
Mhm.
Okay, cool. You might need some Zofran and go from there. That would be a great virtual visit, or an e-visit. Somewhere like hey, I stepped on a rusty nail. Probably need to be seen in person. So
Right.
uh, those
I've
would
done
be things that you would test.
it too. I think I've done all these things, and I'm not a child. Um,
Well, hey, they're common. Things are common. So
okay, so what would you be interested in doing a little lightning round with me if I name a condition and you suggest where a parent might take a kid?
ooh, there's caveats, but yes, I'll be happy
Well,
to do that.
okay, we'll let you do the caveats too. Okay, all right, ready? Okay, a suspected ear infection.
Pediatrician tomorrow in person because you need to see the actual eardrum, not just assessed based on what kids see or kids say.
Okay, can't trust the kid. Okay, an ear
You
infection.
can trust kids, but uh, they will also have a lot of times teeth or tooth pain will
Yeah,
compensate and kind of be there. So you have to just be careful about that.
yeah. Okay, an ear infection on the weekend.
Urgent care would be fine.
Okay, a fever.
Uh, if it's just starting less than 5 days, okay to follow up with pediatrician. Fever that is worsening, not responsive to medication, or happening on the weekend, that would all be reasonable to be seen in an urgent care setting. But fever in and of itself, you can follow up with pediatrician.
Seizure.
Seizure, that's an urgent, or that's a urgent matter. So you'd go to the emergency room, is what I was trying to get out there. So emergency room, definitely, especially if there's no fever associated with it, it would be needing to have further workup and more imaging. So that would typically go ER.
Okay, very serious. Okay, a fall.
Here's the caveat. It depends on what the fall is. If it's a fall in a young child greater than 3 feet, anything of that nature, I would say usually go to the ER, but at least get seen somewhere. We will always redirect you based on the specific situation. If it's going to be more than, and that's not a hard and fast rule, but depending on the situation, we may send you to another location. So I would always start with, is the kid vomiting? Is the kid crying immediately? How big was the fall? Was it from ground level or was it onto a sharp object? All of those things go into our decision making of where they are going. If you're ever worried about that or need to feel like, hey, this fall was bad enough to be seen now, go to the ER.
Okay. Yeah. So don't take it lightly.
No, absolutely not.
What about if a child loses consciousness, like with a fall?
Absolutely ER.
Okay.
If you see vomiting, losing consciousness, or it's a fall greater than 3 feet, I'm absolutely sending you to the ER, because at that point you're pushing towards needing a CT scan or imaging of some kind to make sure there's not worsening issues. That doesn't necessarily mean that is what you need, but you need to. Okay, there she is.
Okay, sorry. I don't know what happened there, but we'll just continue. Okay, let's say a broken bone, or you suspect a broken bone.
Yeah.
Even, maybe it is a fall and you suspect a broken bone because there's a lot of complaining of pain.
Sure. So, something like that, ER would be reasonable. Urgent care, if they have imaging capabilities, is reasonable as well. Usually the pediatric urgent cares around the area do have imaging available, and a lot of them store the things you would need to set that broken bone. But like I said, if there's an open fracture where there's, you're seeing bone, you're seeing muscle, you're seeing skin opened, and there may be dirty infection, that needs the ER.
Okay. What about a mystery rash?
I'm sorry, did you say a mystery rash?
A rash. Yeah, a rash that you don't know what it is.
Yeah, they're all mysteries. Depending on what is, how fast it came on. So if it came on, immediate, like an allergic reaction, ER or urgent care would be very reasonable because you can get in at a reasonable amount of time and see that. If it's something that's been there for 2 weeks and you're just like, hey, I'm not sure what this is, your pediatrician would be able to see that and follow up with you. These would also be appropriate depending, how long it's been there and what the deal is. This would be a great one for like an e-visit to start with.
Yeah, because you can take a picture of it. What about a bug bite? Same thing, bug bite that's swollen?
Same thing, depending on how fast it's swollen. I mean, if there's allergic, well, I say an allergic part to it. Bug bites in general, you're okay to be seen by a pediatrician with just some acute care. You can absolutely do an e-visit, something where you can see a picture, or a virtual visit would be fine. But if you're concerned because there's heat to it or it's getting larger, then, during the week, pediatrician's office, during the weekend or night, urgent care would be fine.
What about pink eye? That's kind of a common one.
That is a very common one. That is one that you could actually do very easily on virtual urgent care, or somewhere that you could see the patient and look at the eye. Excuse me. So I would say, any of the above with urgent care, pediatric office, or a virtual visit. The only thing I would say is if there's other symptoms associated with it, they need to be seen in person. Okay. And so what I mean by that is if they have ear infection, cough, congestion, runny nose, there are viruses that can do that. And so you sometimes need other things to go with it.
Okay. Makes sense. Okay. I have a couple more. What about diarrhea? That's another common one.
Diarrhea doesn't get treated a lot in patients and kids, as long as it is not leading to dehydration. So If it's just starting, it's okay to monitor and then get checked out with your pediatrician. But if it's let's say it's been going on for 2 or 3 days, you're starting to take in less fluid, I would say urgent care or your pediatrician, depending on how fast they can get you in.
Okay, I have one more. If your child is complaining of a bad headache.
Bad headache. The biggest thing or the biggest question for us would be, does it respond to medication and does it go away? If not, then absolutely go to, somewhere you can be seen immediately for that. But just because the headache starts within, 5 minutes doesn't necessarily mean that's the case.
Mm-hmm.
If it's associated with a fall, yes, go get checked out in the ER. If it's not associated with a fall, they've just said, hey, it's the end of the day. I'm starting to get a bad headache. It's not going away. It's been going on for 3-4 hours. That would be somewhere where you could be seen by in a more acute situation, so like an urgent care, and then they could assess from there.
Okay. All right. You did really well with that. So thank you.
I hope I answered those correctly for you.
I think you did. That was good. I really appreciate your time today. So explaining all these different options, and parents do have different options when they're visiting with their doctors. So it's good to know. So I thank you for your time today, Dr. Rice. And again, you can find all of this information from St. Francis Children's Hospital, PJ's Corner, and all of our interviews are on Tulsa Kids on our website. And you can find us in PJ's Corner in the magazine. So thank you so much for being here today.
Thank you so much for having me.
All right.